morning. Are you able to see and hear me clearly? I could see and hear you, but just to confirm, are you able to hear and see me? Okay, that's good. So, good morning. My name is Esmeralda Gonzalez. I will be your therapist, and to give a bit of background of who I am a student at Cal Baptist University. I am currently in the Marriage and Family Therapy Master's Program. So I am also in my first year out of 2. So I understand that you have not previously attended any sort of therapy before. So during this first session, I'll kind of go over some important topics such as what telehealth is, confidentiality, and informed consent. So to begin, telehealth is basically when phones, tablets, computers, or other electronic devices are used to access healthcare. It is basically convenient, as you could do therapy from the comfort of your own home. You don't have to go and drive down to the offices and get stuck in traffic. So it is very convenient. And the rest that we'll be going over today is all part of the informed consent. If at any time you do have questions about the informed consent or confidentiality, please feel free to ask. So I'm going to ask you a couple questions. Are you in a private location, free from any possible disturbances? Okay. Is there anybody in the room with you? Okay. Can you please confirm your full name and date of birth? Okay. Well, nice to meet you, and I'm glad that you're here with me for your first session. I want to ask you, is there a backup number that we could use just in case we get disconnected? Okay. So I'll jot that down, and we'll keep it in a safe place just in case there is any technical problems or an emergency. I'll try to reconnect as soon as possible with you. But if we are unable to connect, then I'll have to call you on the backup contact number that you provided me right now. And it is also best to double check that you have a private, secure internet connection, because sometimes public Wi-Fi just tends to be iffy at times. Yeah, public Wi-Fi is not always the best. Yeah. Can you confirm your current location real quick, and including your address, city, and state, just to make sure that you're here in California? If you're out of the state, then I will not be able to help you, but I will be able to refer you to someone who can in the state that you are currently in. Okay, that's good that you're here in California. So I do also want to assure you that telehealth software is secure and it keeps all your information confidential. So along with the confidentiality, everything that we'll discuss today during the session and future sessions will be kept private between you and me. There are, however, some times where I might have to tell somebody, such as if there is ever a risk of harm to yourself or others, I am required to report that. If there is also suspected abuse, such as with child, adult, or elder abuse, that is also something I would have to report. Another time that I may have to report would be if a court ever orders information from sessions, then I will have to comply with that as well. So I understand that we went through a lot today, and I know it is also just your first session, but are there any questions about anything that we went over today? Not right now? Oh, well, please feel free to ask anytime. Remember that if you ever have any questions about anything that we discussed, just ask and I'll gladly go over them with you. If there's ever time in future sessions where you may have questions about confidentiality or informed consent, just let me know, and then we'll go over all of this again with you. Yeah, well, I appreciate our time together in session today. And when you are ready, you could go ahead and contact the office to schedule a second session. It was very nice to meet you, and I look forward to our next sessions. Goodbye.